I'm going to show you some simple yet very effective exercises for carpal tunnel. In the carpal tunnel, it's a narrow passageway surrounded by bones and ligaments in the palm of your hand. And the median nerve passes through that narrow passageway, going to your thumb, the index finger, the middle finger, and parts of your ring finger. When there's a compression on your median nerve, you're gonna feel symptoms such as pain, tingling, or numbness in any of those areas. If left untreated, the nerve compression can get severe, ultimately requiring surgery. But a lot of times, we're able to prevent that with conservative treatment. In this day and age of technology, aside from back pains, we start seeing a lot of carpal tunnel cases in the clinic. Some of them end up in surgery, but most of the time, we are able to prevent that. And I'm sharing with you the exact program that I'm sharing with my patients as a licensed physical therapist. And stay till the end, because I'm also sharing one exercise that I give to my patients that I don't see a lot of therapists prescribe. So let's get right into it. First, I want you to do a wrist flexor stretch. So extend your arm out like this, extend your wrist, and then I want you to push up on your fingers. So you're going to be pushing up this way, and you're going to feel the stretch down here. Hold it for 20 seconds, and then you relax, and then you do it 3 repetitions. Next, I want you to do a wrist extensor stretch. So it's the opposite of what we just did earlier. I want you to extend your arm like this and flex your wrist, and then I want you to just gently push down near the fingers here. So when you do that, so make sure the elbow extended, hold that for 20 seconds, relax, and do it 3 times. Then we're going to do a median nerve glide. Just follow me because it will be a sequence of movements. So first, make a fist, hold it for 5 seconds, then extend your fingers, hold it for 5 seconds, and I want you to extend your wrist like this, hold it for 5 seconds. And then I want you to put your thumb out. So basically, it's like this, with your wrist still extended. And then after that, hold it for 5 seconds. You're going to turn it facing palm up. So you're going to go like this. Wrist extended, thumb abducted, facing palm up. Hold it for 5 seconds. And then you're going to pull the thumb back. With your wrist extended still, pull the thumb out. You're going to be doing this. Hold it for 5 seconds. And then you relax. And you can repeat that 10-15 repetitions in a day. If you're finding this helpful, don't forget to subscribe. Now, we're going to be doing some tendon glides. There is a sequence for this also, so follow me step by step. There's 2 sequences that I want you to do. Sequence 1, I want you to put your hand up like this, hold it for 5 seconds. After 5 seconds, you're going to make a claw fist. After 5 seconds, I want you to make a full fist. Hold it for 5 seconds, and then you can relax. And you repeat that sequence again. I want you to do that 10 repetitions. For sequence 2, I want you to hold your hand up like this, hold it for 5 seconds, and then I want you to do a tabletop. Hold it for 5 seconds, and then I want you to make an open fist. Hold it for 5 seconds. And then you repeat the sequence again. 5 seconds here, 5 seconds here, 5 seconds here, and you repeat that 10 repetitions. Now I want you to repeat both sequences 2 to 3 times a day. And there's another tendon gliding exercise that I do with my patients that I found to be very effective, and I don't see a lot of physical therapists know about it. And you can see how it's done here.